I always like to introduce myself. Horses are very tactile and they communicate a lot with the sensitive hair and sensitive stimuli on our nose. So you can see here he's really coming into me. I'm just doing light pressure, a little bit of massage and very, very light fascia release hold just around his mane. And I'm just seeing how much he wants. So there you go. He's almost said, okay, thank you very much. And now I normally start my assessment looking at the entire body, but starting with the jaw, looking at symmetry. And this horse came to me because he was leaning on the left rein. So the rider felt like he was heavy. And so I was assessing his jaw, looking at his TMJ. For those of you that want more information on the TMJ itself and its connection to the hyoid apparatus or being part of the hyoid apparatus, let me know. I can do a video on it. But I wanted to test the range of motion out of his jaw and do some light release through the TMJ on the left itself. And you can see here how he opens up his jaw himself and he's working with me. I'm applying the pressure on the left side of his jaw. And like everything in life, I always, once I've done any form of pressure, step away and let the horse process. Now moving on to the right side, there's a big muscle attachment onto the jaw called the masseter muscle in horses, and those horses at a competition that wear a lot of equipment on their face, that muscle can get quite tight. So massaging that area can really be beneficial. Here I'm just testing out the range of motion on the jaw on the right side now. There are studies to show that horses do chew in a particular movement pattern, so it can be more right dominant or more left dominant. It's just think about yourself as a human. You tend to grind or chew more with one side compared to the other there. Doesn't mean this is normal. Something to look at and to speak to your therapist about. As I said before, every time I do any form of an adjustment or any form of mobilization, therapy, any form of pressure, I need to give the horse time. And that's normally when I step away and I just allow the horse to process, to see what they are saying back to me and seeing what effect my pressure or treatment has had on their nervous system. As you can see here, he's starting to release, relax. His eyes have softened completely. Head is lowered. The ears are in neutral position. And the eyes have really, really softened up nicely. The blinking reflex also increased. This time for me is so important. Now going back and checking that symmetry in the jaw just to see if what I have done has had any effect. Rechecking the TMJ alignment and then also the masseter on the right. Now I'm moving on to his neck, checking the atlas axis junction and then moving my way down the lower or upper, mid and lower cervicals. For me, this horse on palpation had a little bit of tension and restriction in the lower cervical, so C4-5 into the CT junction, and you can see here with applying a little bit of pressure, I'm doing a little bit of work through the shoulder girdle into that CT junction. He is again completely letting go. He is relaxing and almost rocking himself, rocking into my body. You can see the eyes have shut and he's just completely letting go. These moments for me are so special, and this is where I get a lot of release and a lot of reward from my job, because horses don't lie, they're very honest, they're very black and white, and you can't fool a horse, you can't fool an animal.